here today 3 pairs of evidence service providers with policymakers. So we have with us today a pair from here, from Uganda, a pair from West Africa, and a pair from South Africa. And we're going to hear from each of these pairs about their experience with this idea of responsive evidence services. So again, back to this notion of being responsive and the use, and hopefully a bit of the thinking about supply also creating its own demand. So we'll hear from each of these pairs for about 10 minutes or so, and then we will open it up to questions from people here in the plenary and online, and we'll see how long we go. But eventually, at the other end of this conversation, we will have a reception downstairs as well. So let me begin by introducing our panelists. From Uganda, we have Mr. Timothy Lubanga from the Office of the Prime Minister, and Ismael Kawooya, a research scientist and coordinator from the Center for Rapid Evidence Synthesis. From West Africa, we have Mr. Ouollo Clément Sekongo from the West African Economic and Monetary Union, and we have Deo-Gracias Houndolo from 3IE. And from South Africa, we have Harsha Dayal, Director of Research and Knowledge Management at the Department of Planning and Monitoring and Evaluation, and Laurence Mahlanza-Langer, Executive Director of SACE, the South African Center for Evidence. So we're going to begin with Uganda, our hosts here for this conference. And one of the things we have heard throughout the first day and a half, or almost 2 full complete days, is the importance of trust, the importance of relationships, the importance of proximity, or being local, and the importance of being timely. So as we're listening to our 3 sets of colleagues, I hope we can all be listening for those things. And if you don't intend to speak about them in your first go-round, let's definitely come back to them in the question and answer session. Okay, so Ismael, I think you're going to kick us off.
All right, thank you, Kelly. I hope by the time I'm done, you'll all be awake. I understand it's such a difficult time to be in a session right now. But I'll start off from the last phrase that Kelly talked about, evidence being timely. When we talk about evidence being responsive to policymakers, I think one of the things that has come out strongly in this conference so far is evidence being timely. But what does it mean? And my colleagues have talked about the Center for Rapid Evidence Synthesis doing the Rapid Response Service. And one of the questions that has been coming up repeatedly is, what does rapid mean? I mean, it could be just a pedantic word to say rapid, but in our sense, rapid is rapid. It's you have to be responsive at the time the policymaker actually needs that evidence. That goes from about just probably a few hours to 28 days as we define it at acres, and that's within the Rapid Response Service. That means when Timothy calls on us and asks for support, that he needs evidence summary, and he says, I have about 2 weeks to prepare for this meeting, then we probably have 10 days because he has to prepare for the meeting. That's what it means. If he calls and says we have 72 hours, that means you probably have 48 hours to prepare. And this is something that we don't just talk about, it's actually what we do. If that's what you need, then you have to make it happen. How do you make it happen? We have the skills, the people, the process experts to actually get it happen. Then within that, it doesn't just come up automatically, and as everyone has talked about relationships, this process of knowledge brokering, rapid response service is really about relationships. And through that, that's when you define what evidence being relevant. Because for it to be responsive, it has to be relevant to the needs. And if you don't understand where the policymaker is coming from, it may not just be the policy, the topical issue he has asked. It's about understanding the environment within which he's operating. If he's going to have a discussion at the cabinet meeting, how you frame your rapid response brief is important, because he's going to go with this brief. You want to help him be confident in it. If you don't summarize it in a way that is going to help him frame in this kind of conversations that he's going to have, then you may just as well keep it to yourself if you keep those scientific jargons to it. Then the other part that I'm just going to talk about before Timothy comes in is, of course, it has to be the best available. And as many in the room are probably methods geeks, a lot has to go into the synthesis. But what does that mean? What kind of evidence are you bringing to the table? And where is it from? So a number of times we get questions where you have to go back and talk to the citizens, get their lived experience about that kind of evidence. So it being contextualized is just as well as important. So when we talk about the best available, you're really thinking about it not just being of the quality that it's necessary, but it has to be of the quantity, and it has to be contextualized to his needs. So just stop there for now. Thank you.
Do I go right away? Okay. So thank you, and good afternoon to you all. So what I'm going to do is to share from a policy maker, as they call us. I mean, everybody is a policy maker, actually. It's not just the people in government. But I'm going to share from our own experience here, government engaging with ECAS as an institution and other partners. And this is fresh. My experience is going to be very fresh for two reasons. One, for some reason, the organizers of the Africa Evidence Network Evidence event this year decided to make it coincide with the day when we are doing our government performance review. So it couldn't have come at a better time. Yesterday we had the whole of cabinet and the most senior policy makers in government reviewing the performance of government in the last financial year. And for me, there are issues that came out of that review in terms of how much we generate and use evidence for planning and budgeting, which I think is relevant for this discussion. So that's the number one reason why it is fresh. Number two, Uganda has a national development plan. We are now in our third phase. And that national development plan is halfway. We are halfway its implementation. We just completed the midterm review of the plan. And during the midterm review, we found that for all the outcomes in the plan, the outputs that are supposed to be delivered by the different government ministries, halfway, 56% of those outputs, we were not able to assess them at midterm review because of lack of data, because we were not tracking them. And that is a big, 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 big problem. So it was very difficult to fully understand the extent of implementation of the plan halfway its implementation. Now, as you can see, there are issues there around how much we are consuming evidence, how much we are relating between the people who should use the evidence and the people. And we are not short of research. We are not short of research in this country. We are competing very, very favorably. Actually, in the continent, I think South Africa and a couple of other countries are ahead of us, but we are right up there in terms of generation availability of research and even development of the research fraternity and So we're in health, in some of the areas we're actually right amongst the leading. So the question then is, why is there such a dire underutilization of evidence in planning and budgeting? And there are many reasons. I'm not going to bore us. I think over the 2 days, we have heard a lot about evidence should be accessible, evidence should be timely, it should be in the format that is consumable, because you can have the evidence, but the policymaker that needs to use it actually is unable to consume it, or maybe it is not disaggregated enough to enable decision making. The point I'm going to speak to more is around knowledge of its existence. So my preamble examples of the two events, one of the issues that was actually surprising is that many times the policymaker does not even know that the evidence is there, is available, and where he should get it. And then when they know about the evidence, there are many other factors that limit their access to this evidence. Let me give an example here of how one of the government departments that has worked with the ECAs has been able to benefit. And this is an example I just learned of last week. So last week we had an event with the ECAs, and we were sharing experiences and discussing how can we strengthen the linkage between this evidence generator and evidence user. And we had a testimony from the Ministry of Education. So at some point, a couple of years ago, there were a number of media reports about indiscipline of teachers, okay? So the national dailies would run a story, a teacher in school X has embezzled school fees for the children, and the children were not able to register for exams. Another day, an alarming story about how a teacher has abused a parent. Another day, a story about a teacher defiling pupils, defiling the children that they are responsible for teaching. And so the Ministry of Education got concerned and said, this amount of negative publicity is too much, and we are not going to be able to manage. So the question was, what can we do? The issue also reached cabinet, and there was a quick directive that the Minister of Education should respond in Parliament. What is the ministry doing? What is the policy framework for governing the conduct of teachers? And so the teaching is called the Education Service Commission. The Education Service Commission was given a task to provide a comprehensive paper that is going to highlight the policy reforms that government is going to implement to address the issue. So, and they were given a short time, within a month, okay? So the commission was stuck. How do we do this? We need to study the problem. We need to look at all the issues across the country. We need to consult widely and come up with proper recommendations. So for some reason, the Education Service Commission was in touch with ECAs. Now, ECAs has a pool of researchers with the skills and capabilities of, looking at the evidence that is available quickly and packaging it to inform policy. And just by that, they contacted ECAs as an institution, and they were able to, within a very short time, within a day actually, they were able to put together, to look at what is available, what evidence is available, what is the scope of the problem, what solutions have worked elsewhere, and they were able to advise the ministry. And within 2 weeks, the ministry was able to respond to this. Now, there are many cases of such problematic service delivery issues which can never be addressed because the responsible policymaker does not know where to go, does not have the capacity to do enough analytical research work to get the evidence to inform a quick decision, does not know even of the availability or the presence of ECAs and similar institutions, And this can be broadened further. So the point about bridging the gap between the policymaker and the evidence generator is quite important. I think I should stop there, and I thought that I should just share that experience to elaborate how we have been able to promote it with ECAS. Thank you very much.
This is a truly excellent example. Ismael started out by talking about the importance of relationships for knowing what's relevant. And your example really gives a good sense of the importance of that pre-existing relationship between your colleagues in education and ACRES. He also talked about quality of evidence, being timely, how to frame things. And as you talked through your anecdote, we really heard echoes of that mental framework that Ismael gave us. Really an excellent example. Thank you, Timothy. Okay, let us move next to West Africa. And Deo, I think you're going to kick us off, yes? Okay, thanks.
Thank you very much. Hi, everyone. I'm Deo, Senior Evaluation Specialist at the International Institute for Impact Evaluation, and currently the head of our regional office, the Secretariat of the West African Capacity Building and Impact Evaluation Program, working with 8 Francophone countries in the West African region. And I guess from that presentation, you understand why it matters for me to share the experience we have in that part of the continent with respect to evidence synthesis. And I like your word of mental framework. The mental framework I often use to approach this is about having a market where demand and supply need to meet. But in our world, it's not enough to have demand and supply meet. It's quite important to make sure that we have mechanisms to track consumption of whatever product is generated. So speaking about those 3 pillars, in the WACIE program, we've developed what is called a help desk. And our help desk, the way it works is to be able to react as quickly as possible to demand coming from decision makers, coming from policy makers, coming from researchers also, in terms of existing evidence that can be synthesized and given to them. But what we realize is that even though we created the help desk, people would not come right away. So it's quite important to sort of advertise, be active, proactive about letting them knowing about the product and making sure that the product removes some of their pains. And one of the most important pain that we've identified in this process is being timely. One of the most critical challenges of researchers is that the requirement, the technical requirements sometimes make us think that we have plenty of time. But if the use of evidence is really the end game, we need to be sensitive to time and find alternative approaches that do not compromise quality of evidence, but still addresses the need of policymakers, which is an approach that we've used through the help desk. And eventually, we got our very first request coming from the government of Benin. That was about the impact, the possible effect of vocational training as a new way to invest into education in order to improve employment, youth employment in particular. So we've used the existing evidence to put together the evidence synthesis and share that with the government. It went quite a long way, not because after handing it over, we stood back. We've developed a mechanism to follow up with them and be also patient with them, organize workshops where we present not only to the high-level decision-making body, but also with other staff that are intermediary between researchers and the key decision makers. That's one aspect. But in this whole model, the way I see it is that at some point, we need to make sure that while we supply the market, we will not be able to sustain the demand effort going after them each and every time. What we want is at some point, they start feeling the need to access evidence. And we started this experience back in 2019. Can you imagine that after almost 4 years, we're still around, pushing them, reminding them, organizing workshops at conferences, trying to harvest questions that we can address. 4 years. So being persistent matters a lot. And after 4 years, now we make less effort because they know us. They know that we're around for questions that can help them do better the job that they are paid for. And hopefully, after 5 years, maybe 10, the demand will now come to us and we will feel more comfortable. That's where I have a call for anyone working in this field, anyone funding activities, to remember that it's not a matter of 2 years of investment, 3 years of investment. If we were to have system transformation, government transformation, it's a long-term game, and we should be prepared for that. To finish on this first round, partnership matters a lot. Partnership matters in the sense that, at 3IE, within the WACIE program, we thought it's important not just to be researchers. It's important to have research mediators. And I myself, I see the work I do as a work of a research mediator, someone who understands the world of researchers, the importance of method and quality of evidence, but who also can interact, engage with decision makers, knowing that the decision-making equation is not made essentially of evidence. They are, evidence the way we define it. No, they have other types of evidence that needs to be factored in order for them to make the ultimate decision. How do we then work with those constraints and achieve whatever we want to achieve? And that's where we found one of our key partners, the West African Economic and Monetary Union Commission, represented here by Mr. Ouollo, who plays a key role in determining the regional policies. So working with such a partner is an asset, and strategically it matters not to walk alone the distance we're talking about. That at the end of the day, our policymakers will be using evidence that's high quality evidence and demand evidence in order to make the market work efficiently. So essentially, Thomas, that's what I would like to share and hand it over to Mr. Clément. Mr. Clément is very comfortable in speaking French, so I think his presentation would be in French. I'll be around to support translation, and anyone else in the public is welcome. Thank you.
Good afternoon, everybody. As Deo said, my presentation will be in French. Alors, je suis évaluateur senior à la commission de l'UEMOA, au cabinet du président de la commission de l'UEMOA, où je suis conseiller technique en matière d'évaluation. Ma présentation va porter sur 3 points. Alors, d'abord, une présentation rapide de l'UEMOA. Ensuite, la fonction d'évaluation au sein de l'UEMOA en termes de production de données probantes. Et finalement, l'utilisation des données probantes pour la prise de décision. Alors, en termes de présentation, l'UEMOA est une organisation sous-régionale qui couvre 8 pays de l'Afrique de l'Ouest, avec une superficie d'environ 3 500 000 km² et 120 millions d'habitants dans ces 8 pays. L'UEMOA est donc l'organe exécutif de l'Union. Je vais donc vous présenter les objectifs de l'UEMOA. C'est donc de renforcer la compétitivité des économies de la sous-région, la convergence des performances en matière de politique économique des 8 pays membres. Nous avons également pour objectif de créer un marché commun entre les différents pays, de coordonner les politiques sectorielles nationales et d'harmoniser les législations nationales également pour avoir un espace homogène. En termes d'architecture institutionnelle, l'UEMOA a des organes de direction, notamment la conférence des chefs d'État et de gouvernement, le Conseil des ministres des États membres et la Commission que je représente ici. Nous avons les organes de contrôle, comme la Cour de justice de l'Union, la Cour des comptes, le Comité interparlementaire, qui est une sorte de parlement communautaire. Nous avons des institutions spécialisées comme la Banque centrale de l'Afrique de l'Ouest et la Banque ouest-africaine de développement. Nous avons également des organes consultatifs comme la Chambre consulaire régionale, le Comité du travail et du dialogue social et le Comité du contrôle parlementaire qui réunit les territoires. La commission donc, que je représente est l'organe exécutif. Alors, nous avons donc plusieurs missions que j'ai déjà évoquées. Alors, je vais aller un peu rapidement pour dire que nous avons, en tant que commission, le rôle de mettre en place des politiques sectorielles et communautaires qui impactent la vie de 120 millions d'habitants de la région. Nous avons des politiques communes, des politiques sectorielles qui sont déterminées par le traité fondateur de l'Union. Vous avez ici la liste de 15 politiques que nous avons, des politiques sur la convergence économique, sur la politique commerciale commune, des politiques en matière d'aménagement des territoires, de transport, de politique agricole, de politique industrielle commune, etc. Nous avons donc 15 politiques que nous mettons en œuvre pour lesquelles nous avons besoin de données probantes pour prendre des décisions, comme je l'ai dit, qui impactent la vie de près de 100 millions d'habitants. Alors, pour avoir donc accès à ces données probantes, nous avons donc bien conscience de l'intérêt de réaliser des évaluations de politiques et de programmes que nous considérons comme étant essentielles puisque nous sommes confrontés à des exigences de bonne gouvernance, des politiques et programmes communautaires, des exigences de redevabilité également à l'endroit des organisations de la société civile, des acteurs non étatiques et des partenaires. Nous avons également des exigences de résultats en matière d'intégration régionale. Et tout cela vient donc accroître la demande de données probantes pour la prise de décisions. Alors, pour faire face à cela, nous avons donc mis en place une direction rattachée au cabinet du président qui a donc pour mission de consolider l'efficacité des services de la Commission et de développer la redevabilité dans le dialogue avec les partenaires. Alors, cette direction donc, a été mise en place pour, dans le cadre de la gestion axée sur les résultats que nous avons adoptés depuis 2011. Alors, je vais aller rapidement. Alors, pour donc, développer donc, les données probantes, nous avons besoin donc, de l'accompagnement des partenaires. Donc, nous avons notamment tissé des relations avec WACIE, représenté ici par Deo. Mais déjà en 2017, nous avons signé un mémorandum d'entente avec 3IE pour nous appuyer en termes de production de données probantes. Nous espérons que ce partenariat va être mis en exergue très rapidement parce que, comme je l'ai dit, nous avons 15 programmes pour lesquels nous avons besoin de données probantes. Nous avons déjà réalisé des évaluations sur la politique agricole de l'Union, sur la politique industrielle, etc. Le WACIE et 3IE nous ont accompagnés récemment sur l'évaluation du programme spécial de sécurité alimentaire pour lequel nous avons également des données probantes. Alors, nous sommes ici essentiellement en tant que demandeurs de données probantes, pas en tant que producteurs, parce que nous n'avons pas toutes les compétences internes. Donc, pour mener les études évaluatives qui vont aboutir à des données probantes. Donc, nous développons des partenariats, nous sommes preneurs de tous les partenariats qui peuvent nous permettre d'avoir des données probantes que nous utilisons pour élaborer des directives communautaires, des règlements, des décisions, des protocoles et actes additionnels qui vont impacter la vie de plusieurs personnes. La décision que nous prenons sur la base des données probantes concerne la gouvernance économique et la convergence, la construction du marché commun et la réforme sectorielle. Ces données probantes sont essentiellement analysées par la conférence des chefs d'État et de gouvernement, le conseil des ministres statutaires, la commission elle-même et le comité des experts statutaires. Alors, donc rapidement, pour conclure, en termes de perspective, la commission est en demande de partenariat avec des acteurs comme 3IE, comme WACIE, comme le Centre CLIER francophone, et éventuellement avec AUN, pour donc produire des données probantes qui pourront nous aider à éclairer la prise de décision et l'orientation qu'on doit donner à nos politiques et nos programmes communautaires. Je vous remercie.
Thank you very much. Very, very interesting perspective from West Africa. Deo started out talking about some economic concepts and borrowing those ideas and bringing them to the market for evidence, if you will. The importance of demand and supply. And as a relative startup, the importance of getting those initial clients, the importance of advertising, and the importance of following up with them to make sure they were satisfied with your service. Today at lunch, 3 different people asked me if I was happy with my lunch. Service providers follow up to see how their product is being reserved. And if we could maybe push the metaphor a little more, Deo talked about that this isn't going to happen in a flash. So we do need patient capital from our funders as evidence entrepreneurs. And you could see from the experience of Uganda what happens when you have a mature business model. You see how well that experience worked that Timothy talked about with us. And I'm really pushing it a bit now farther, but Mr. Clément was talking about not only the partnership with capacity building, but also the importance of having evaluation demands put on governments. In other words, what we have there is the state acting, if you will, to complement the market and to help us get a more efficient market functioning. We have a very interesting picture emerging as we go to South Africa. And so, Laurent, what can you tell us about the experience you have had with government? And then let's definitely hear from the perspective of government.
Thanks. Well, first checking, hopefully you were happy with your lunch, right? Cool. Welcome to the South African corner. So Harsha and I have been on a journey together for the last 7 years, trying to get rapid and responsive evidence service off the ground between national policy departments and different forms of producers of evidence, NGOs, researchers, etc. And I want to share a little bit of that journey with you now. So it's been 7 years. I think as any journey, there have been up and downs, there have been dead ends, there have been U-turns, but it's been a beautiful journey all in all. And I think it's a nice opportunity to look back and where are we after 7 years. And so we have covered 7 different national policy areas in those 7 years, and the responses took on very different formats in each of them. So it's quite interesting that I think we're still quite far away from a standard model that we can just plug and take into a new policy area when it comes to responsive evidence services. And so we have different trajectories, different pathways, and it really differed in each of the 7 policy areas. But one thing that we had in common throughout each and every response and each and every policy area was that we have co-produced. So we've co-produced together right from the start a co-production approach that was led by government, by the users of evidence, so it wasn't initiated by researchers. And I think that has informed the way we've been working together for the last 7 years, and it's probably one of the core values. And I guess for me personally, one thing that has made this journey so beautiful. But maybe we can start at the beginning. So this journey started when I was on leave, and I suddenly got an email in capital letters, urgent, from Harsha, and I had to be very responsive, very quickly. So what happened there, Harsha?
Thanks, Lawrence. So, you know, doing that urgent, obviously with exclamation, 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 like you need to read this immediately, was just me relaying a message and not me. So, you know, where it comes from. But that was one of many policy moments, I would say. And if you didn't respond, Lawrence, what would have happened? There would have been no relationship today, right? So I think, you know, everybody has been mentioning how important relationships were. And it was one of those moments where you were hoping that you're actually looking to somebody who can respond in a moment of need, and in a moment of need that was well defined. But it was our struggle to actually secure researchers that would be able to respond to this need. So that's when the journey started. And I think when colleagues spoke from Uganda, it was almost like you already describing a context that is very similar, it's very known, right? So if I can just fast forward, post now 7 maps and policy areas that we did work through, we are not working in one sector. So it's not just health, it's not just education, it's not just environment or economics. We are servicing a whole lot of different needs, different requests that straddle all across these sectors. So how do you build an effective service that is now changing lanes constantly like this, right? As well as, I think everyone in this room understands the politics behind it. That is an unstable environment. It's somewhere where how do you build for the health sector? Is it going to look different for the education sector? Is it going to look different for the environment sector? Noting that we're also dealing with different stakeholders within that grouping. So if you have the health sectors, you know that there's different professors, there's different experts, but then the education has their own, environment has their own. Now that was the context within which we were working. So co-production was, somebody mentioned from the AEN family, it's in our genes now. We have encoded it into our genes. And this is our approach, our process that we follow. And there's a whole write-up on it. But I think that for ourselves, if you see that, do you want to define us as a service rendering, or are we responsive? Is our responsiveness in providing that service? So we were trying to work that out, and I think over the years, from one policy area to another one, we found ourselves building something. So what is it that we were building? Maybe there's a different face that you see on the outside, but there was something we were building. And at the bottom of, so if you talk about a foundational way, there was some level of research infrastructure that we didn't have, that the evidence community has, right? Now, I'm not saying go out and, you know, have a library service, but there was essentially a lot of requests coming just for where can I find it? And I think all the colleagues were mentioning that. So can we not just have and equip these policymakers with a search facility? And that's what we brought in. So on a very, doable way, instead of outsourcing a project and financing that, let us bring in the software that will enable them to do their own searching outside of Google. So we started to build this infrastructure. But part of that infrastructure, of research infrastructure within the policy space, we also realized that it's the stakeholders, right? And it's all these differences in these relationships. So we had to keep tabs of who is doing what and in what space and informing what. So it was this multiple sources of information that we had to make sense of, which is when mapping was the most appropriate way that we could build knowledge resources that was meant to be used within the public sector. And that's why mapping is not just a map, move on to the next project, another map, move on to the next project. It really is a gold mine of information, like the one from developmental state. We're actually using that knowledge resources till today, which was the second map that we did, right, Lawrence? And took on a very different role, not just evidence of effectiveness, but theoretical evidence. I struggle to know how a responsive service can be done without this infrastructure, without this access to this infrastructure. Some of it we've built in-house, but that was the request, that was the urgent, please help us. So I'm happy to say that on a very personal level, there was this vulnerability that we had to know what we don't know and what we can't do. So there's this codependency. We are 4 people in our unit. So there's no way we can work on our own. And I think this on a personal level was to say, we need you, and this is what we need you for. So we were actually trained by the best. 3IE came in, Bertu was the first one. We flew over and said, teach us this mapping. She taught us the mapping. ECRIS was the second level of training we asked for, because they have done rapid responses. This 28-day one, it's a holiday for us. We have like, can you give it to us tomorrow? And when you want us a request by tomorrow, where do you draw it out from, right? So I think in terms of responsiveness, it's the secret of keeping your policymakers engaged. Don't say, let me negotiate. Yes, we are negotiating the time frame, but it's the quality that you don't want to compromise on. So we keep them engaged. By keeping them engaged, we are asking what the brief is. And when we reflect the brief back to them, they realize, I wasn't very good at asking the question well enough. So we keep doing this until we define what it is that they need. So I was asked to write this up because it really isn't. So there's this write-up for the past 10 years of what we've been doing. And it is on our website, so I cannot do it in 10 minutes, but that is it, yeah. But Lawrence, sorry, Chair, I just want to pose a question. Because a lot of challenges get posed about the demand space, right? There's all these political challenges, there's this unstructured environment that researchers are not familiar with. Can I pose this back to you? What are the challenges on the supply side? Can you share that with us?
I think it's a really important talking point to just bring up, right? So it sounds all great and it sounds rosy, like 7 years, 7 policy areas, but behind the scenes, it was really hard work. And oftentimes we talk about the demand space as unorganized, unstructured. They only give us 24 hours. This is so unfair. Why don't they know in advance what questions they have? We're not much better on the supply side. Like, very honestly, when we're based at university, nobody in the university cared about the rapid responses. The dean, they cared about academic incentives of journal articles. Whether or not Promise and Ndilo, you've probably seen a lot, ran around and informed a national policy with data and evidence, that doesn't really count in the university system. There's no kudos for that. You should have published an article rather. So we really struggled on the supply side to educate and advocate in our own community why this is important. And I will not go into the practicalities of it, but trying to manage a responsiveness grant where you can't really say what meeting is for what purpose, is also a beauty in a university system. And so it's an interesting talking point, but ending on a more positive note, really echoing that only together were we able to pull this service off. And thanks to ECRIS and thanks to 3IE, because without you having co-production in your DNA as well, there wouldn't be our service today.
Just on a lighter note, I do note that I'm the only woman on this panel with a chair, and I hope that's not a message to say policy making is a man's world, right? So we're not saying that, definitely not saying that.
I was really struck with Lauren's first comment that the email he got from you said urgent in all caps with 3 exclamation points. And now I'm all the more struck by it. I really, really liked your summary that ended with the engagement with the policymakers of reflecting back to them what question they're asking and helping sharpen that. From my mind, as having been on the research side, it's so, so important. And also having been in the policymaker's seat, also incredibly important to have that engagement and that thought partnership. I also really liked the point you made about the willingness to identify what you don't know and to be able to build on that then. And this point, finally, about incentives that Laurent made, I think is extremely important, that the researchers face different incentives than those of us who have to respond and provide evidence. Okay, excellent panel. I want to thank all of you, and now give our colleagues in the room an opportunity to ask questions. We started a bit late, so we do have time to run over, as long as you all have questions and are interested. So perhaps if we could start first with questions in the room, and then after that, we'll go to questions online. Okay, do we have a microphone available? Okay, I think first we had here in the middle aisle, halfway down there. Yes, a woman has her hand raised, and then all the way back, and then around 2 stops in the back here, and in the back with the gentleman on the your far left.
Thank you to the presenters. I came a little bit late, so I think I caught the last 2 presentations. My name is Violet Murunga. I work for the African Institute for Development Policy, AFIDEP in short. I'm going to take it from the tail end because at AFIDEP, I do some work on evidence synthesis and translation. And being a transferable skill where you can go from to different, use the same approach in different sectors, I find it challenging when I'm working in a sector that I'm not an issue expert, and it would be really helpful to understand how you manage that. So I have an issue expertise in adolescent sexual and reproductive health, but currently I'm also supporting a project that is focusing on advancing domestic health financing in Africa. And it has surprisingly complex concepts and frameworks within it that I have to, so there's a learning curve, and then you're doing that in the context of timelines to meet decision makers' needs, timelines to meet the funder time requirements. So it's really challenging, and I would really like to understand and hear how you all, address those challenges in your work.
Okay, excellent question. And now we could go to the gentleman in the far back.
Thank you, panelists. I have a question for the commissioner from OPM. The government has institutions that are in charge of doing research, and for example, EPRC, and then UBOS. I would like to inquire from you, do these, and of course you also use private institutions to do research, are these institutions aware of the evidence inclusion into research to do decision making? And if not, what can be done? Because all the researchers literally in Uganda do their research based on the UBOS data. So I would like to know, is there anything you're doing about that to make sure that all the institutions are aware of the evidence part? Thank you.
Okay, thank you. And then the far back in the right corner. We'll take one more, sir. And then.
Thank you to the panelists. My first point is actually for Lawrence. I think, Lawrence, you made a mistake of telling us how to make sure whenever we send you an email, we receive a response within 2 hours. If we put urgent and 3 exclamation marks, so just remember it. No, I'm kidding. Lawrence is super responsive always. Actually, my question is for Harsha, and Mr. Clément. I can translate after, but my question is about one challenge that we face sometimes is on what is the best format or layout to present the findings of our work very often. We often face cases where we are very happy with our super detailed reports with a lot of very interesting things inside, and when we present it, that's too much. That's too complex, too much details. So I would be interested about your perspective on what is the best format. En traduisant pour Monsieur Clément, ma question portait sur quel est le format le plus intéressant pour vous lorsque vous recevez des travaux sur les données probantes. Parce que c'est vrai qu'une problématique à laquelle on fait face parfois en tant que chargé de recherche, c'est produire de la recherche est une chose, mais parfois le niveau de détail ou le format qui est proposé n'est pas toujours le plus idéal pour les gens en charge de la prise de décision. Donc, intéressé d'entendre vos perspectives sur l'idée du format. Voilà, merci beaucoup. Thank you.
Okay, thank you. Let's take one more up here, and then we'll turn to the panel.
Thank you so much, Chair. One observation, we didn't understand the French presentation. That's just one observation. But my question is to Akers. If I give you $1 million today, what would you do different in getting this evidence going out?
Okay. Excellent set of questions. I wonder if we might start with Aker or Uganda, and both of our colleagues, with both the first question and the last question. So the first question was about complex frameworks in a different sector and time pressure. The last question is if you get $1 million. And then perhaps we could turn to Mr. Clément and Deo, the questions about format, layout, and also whether there's awareness of institutional requirements. And then perhaps turn to Harsha on the same question on format and layout. So.
All right, James, first, do you have $1 million? We could start from there and then have a private conversation about what we can do about it. But there's definitely need for it in the kind of work that we do. As you've learned, as everyone has talked about, these relationships, first and foremost, need to be sustainable. I think when we say that, it just seems sort of a passing remark that it has to be sustainable. But I can imagine if at one time in the 7 years, Lawrence was working with Harsha, and he got probably about 3 years, and he was like, you know what, funding is done, so this is it. We have been fortunate. We've been around for over 10 years. And so you have to be available, otherwise the moment that you're not, then policymakers are either going to revert to what they were doing, or probably you hope after some time they may pick up, but that's a very long stretch. And like I've said, we've been around for quite some time. The other part that I would want to mention is that as I'm talking right now, I'm sure a few years back, Lawrence probably, not probably Lawrence knows this, it was Rona. And she was moving all over the world talking about the rapid response. Of course, she started it. She's, as Lawrence puts it, do you say the godmother or something? Yeah. So now I'm the one talking. So there has to be the transition in the leadership. So you have to be aware of that. In the morning, my colleague Edward Kayongo was the one talking. That shows that there is growth. It's not just about one person, because when that person is away, then what then happens, if I'm talking about the rapid response service and I'm saying when a question comes in, all hands on deck, who is the whole hands? If you're just seeing one person talking, so that's very important. Then the question about if a question comes from a topic that you are not comfortable with, what do you then do? I think on Tuesday, we was having a chat with Ruth in the group, and we were introducing ourselves. I mean, I've known Ruth, I think, at least for about a few years now, a few more years, probably more than 3 years now, and I mentioned that my background is medicine and epidemiology, and everyone seemed surprised. And they were wondering, how did we not know that? I mean, I get to the room and I'm talking about education. And at one point, I'm dealing with questions from a development economist. I'm a medical doctor with a background in clinical epidemiology. What I prize myself in is having the skills, the process skills, being able to find the evidence. But also within that is, Harsha mentioned from the policymaker side, the vulnerability of knowing that you're not the expert in each and every topic. So we will always co-opt on someone, content expert, to help us understand these frameworks, understand the language of the issue that you're dealing with, so that it makes it easier for you to then now synthesize the evidence that you are talking about. But definitely finding it and putting it together, that I can do, and probably talk about it for that period of time. Thank you.
Timothy, anything to add?
Okay, thank you. No, I have just one question actually, direct to me, and I will be very brief to it. The question was that do the research institutions in government or established by government understand the concept of evidence in doing their research? That's really the question. And my answer is a big yes. A big yes, because actually the Economic Policy Research Center that you referred to, EPRC, by its nature, it's meant or established to undertake research, to advise government on economic policy. So by its nature, it's very, very evidence-based. If it is recommending some policy change on monetary policy by the central bank, what is the basis of its recommendation of that policy change? The Economic Policy Center, as you understand, is under the Ministry of Finance and is very much related to the macroeconomic department and the central bank. So it's actually established with that understanding that it will be largely evidence-based. But also the personalities there. There are some in this conference. I saw Elizabeth in this session. Actually, maybe she has stepped out. And several other personalities there. Dr. Madina, I think, was also around. They are one of the strongest evidence-based promoters and advocates in this country. So the answer is yes. And the same with the Bureau of Statistics. The Bureau of Statistics annually, at the beginning of the financial year now, they do contact every government ministry and ask, what are the areas where you need us to collect data through national censuses so that they can be useful for your planning and program work in the subsequent years. So again, by their strategic plan, they are supposed to be evidence-based. So if they understand, the answer is yes. And the only other short comment I want to make is that to my sister, your dilemma of working in a field where you don't have, where you would imagine you don't have the competences is not only limited to you. Let me give you my quick short experience. There is something called International Health Regulations, signed in 2005, and it is about, it's by WHO and all the countries that are members, I think, of the UN. And it's about countries being prepared to deal with the health hazards and health risks. Now, right now, there is a global evaluation. It's called JEE, Joint External Evaluation of the International Health Regulations, and we have it in every country. Now, for me, my background is economics, but because I am heading the National Office for Evaluations, I am heading the joint evaluation for the International Health Regulations in Uganda. I can assure you the amount of health terminology that is contained in that evaluation gave me so much headache in the initial years that I actually faced the same challenge that you have faced. But it is actually an exciting experience. Thank you very much.
Excellent, thank you. Okay, let's move now to West Africa. We had a couple of questions, one about format and layout of making evidence useful, and the other one was about awareness. Mr. Clément?
Thank you. Well, regarding format, I think we have the classic one, being paper-based, emails, organized workshop. But what I think we're not doing enough and we should be doing is to take advantage of the digital transformation the world is going through. We have designers who are really good at preparing these quite affordable apps that we can use to promote accessibility to evidence in real time. Decision makers do not need to be in their office for evidence to be available to them. We should find a way to bring evidence to them in their cars, right after a conference, at a coffee break, and so on and so forth. And the classic formats, while they're not really bad or wrong, cannot reach those moments, while those moments are critical for decision makers. So essentially, that's what I would say. We need to do more with respect to digital solutions in our field of evidence-informed decision-making. Regarding awareness, yes, we need to continue to be persistent in whatever we're doing in our different capacities and collaboration. There are things that 3IA has been doing for ages now, and at some point we thought it's important to partner with other organizations so that the experience of not having, not having the same persons coming over and over again helps also. Having new ideas, new people talking about the same topic could influence how policymakers, decision makers react to the song that we've been singing for the past decades. Thank you.
Thank you, colleagues. I think that question about working in different sectors without the expertise actually takes me back on my own journey, because we are now a unit within the policy making, and I think colleagues, Chris mentioned proximity. So proximity is important, but I think for myself, on a personal level, I did get looks, I would say, an attitude that you're not the expert in the field. But we never claim to be the experts either. So we have a very deliberate strategy, one of 5 strategies in the co-production model, which is matchmaking. And we abide by that. So what I mean is that you will have your methods people, and we spoke about methods here, right? So we want quality, we want assurance that we're using our methodologies in the right way. But we match that between government and the research community. Then we will match the experts, the sector experts, the content experts, between those out there who are the professors and the experts in the field with government officials who are also experts in the field. Then we have, specific other levels. So when we were busy doing the mapping, there was the digital and the business intelligence language that we didn't know, but we had to match them to the IT professionals in government as well. So there was a very deliberate process. In fact, even information searching, it's people like from ECRIS and even from WACIE, from the impact evaluations, we learn from the best, right? So that we bring it into that field. But what does it mean for our role? So this is the part that became clearer for me, that we were literally playing this brokering role. No one defined it. No one told you this was your job to do. We were just busy doing it. And that is partly how we've actually survived. And this is a survival strategy, to be able to not be experts in every field. You'll never be an expert in every field. So this part of managing a process became so critical. In terms of the second question that was posed to us, in terms of what we know when we do procurement and commissioned work, our evaluations unit has specifically put it into the terms of reference for the format that we want it in, 1.5.25. And I think this is what we learned from our 3IE colleagues as well. 1.5.25, 1, give us a policy summary, 5 pages of an executive summary, then you'll get 25 and maybe 60 pages of a very, very detailed report. But those are general reports. Those are general reports. What we did have is this negotiation period when we do with the briefing with who are we being responsive to? Are our clients, in-house clients? And then we say, okay, if you want a quick search, then we'll do a briefing on the evidence. So we're not analyzing, we're not doing anything, it's an evidence brief. If you want a policy brief, we will convene the necessary stakeholders and we will do the policy brief. If you want a rapid evidence synthesis, we'll do that, which is what we did as well. So this is the kind of product negotiation that we do given the time frame and making sure that it's quality assured. So there's a range of them and we're happy to talk with you afterwards. Thanks. I don't know if Lawrence wants to add anything.
Just a quick point. I think I would completely agree with Deo that, in a sense, we have these digital technologies now, and for all of us as providers of rapid response services, there's an elephant on our phones, and that's ChatGPT. So why would Harsha and other colleagues go to us, who still need at least a day, to answer a question that ChatGPT can beautifully answer within seconds? And there's all sorts of quality issues, but essentially, that's our new competition, in my opinion, as providers of rapid response services. And so I fully agree there with Deo that we need to bring these digital technologies into our space and make use of them.
Really, really good comment. If you can bear with us 5 minutes, do we have anyone checking for questions online? I think our online colleagues have gone to their happy hour in their dispersed locations. Okay, if we don't have any more questions, then I really want to thank, we have one more in back. Oh goodness, 2 more in back. Okay, 2 quick questions, then we'll do 2 quick lightning responses lightning responses up front.
Okay, thank you very much to the panelists. My name is Anne Okello. I work with Afrobarometer and I am based in Nairobi, Kenya. Mine is more of a reflection and not really a question, because I have actually enjoyed the panel where we have people from both the supply and demand for evidence. So it's just something that has been piquing my interest from the data that we generate as Afrobarometer. We find that most Africans have high trust in informal institutions. These are traditional leaders and religious leaders, and actually trust in formal institutions like the police is at an all-time low, but with the government, the high court, the courts, and also legislature, trust in formal institutions across the continent is quite low. To give an example, like where I'm from, Kenyans have high trust in religious leaders, and second is the military. In Uganda, where we are now, Ugandans have high trust in religious leaders first, secondly it's the traditional leaders, and third is the president. But like other countries like Sao Tome and Principe, Zimbabwe, Tanzania, trust in informal institutions, which is the religious leaders, is very high. South Africa is quite interesting because South Africans have high trust in the media, independent media, and also government media sources. And to West Africa, I just ran the data quickly on Ghana, which is quite interesting. Ghanaians have high trust in the military, but religious leaders come second. So just a quick example of how our partner here, our local partner in Uganda, is trying to work with this, is we are really trying. I don't mean that we have to go to the churches and look for the imams and speak to them, but when you look closer, you find that these religious spaces are institutionalized. Like in Uganda, we are currently working with the Interreligious Council of Uganda, and we signed an MOU with them, and we are trying to disseminate our findings in the most easiest possible way. Because as the session before this with Evelyn, what she said was that, you know, Africa is all about informality. You might be trying to influence policy in a government space, but you go and approach the government leader and they say, oh, let me just make this call to whoever. So that's what we're trying to do. And even to build these relationships, even with like people in the donor community. I remember we presented these findings to, it was a technical working group on democracy. So we had various donor groups. And when we say that people in this country really trust the religious leaders, the first question they said was, but are the churches democratic? But again, they called us once again because they were trying to find a way of how to penetrate, because you find that in our governments and these other high spaces, people do make informal calls, and this we can try to penetrate this through these informal institutions. This is just a reflection. Thank you.
Really interesting. And just before you lose the microphone, could you tell us again your institution, where you're from?
Okay, I work for Afrobarometer. That's a Pan-African Research Institute that has been in operation since 1999. Yeah.
Thank you.
Hi, everyone. Nice to have a good panel. I just want to make a challenge to my colleague, the Harsha. I know we're government, we should be talking on the sidelines. I want to challenge you, Harsha, in terms of, you spoke about the proximity. And I also think your department has a close proximity to the highest office within the country. Can you push for the institutionalization of evidence in other departments? We've been trying, but there's a little bit of a pushback from certain departments. We can learn from what you guys have done. Obviously, you'll work with Lawrence in terms of conceptualizing that particular process on how to do it. This emanates from also the National Treasury in 2022, if not 2021, where they published a report on moving away from capacity development towards capability development. So I think what you have done within DPME is the actual implementation of the capability development, because after you are gone, whether you go to academia or what, the institution itself and what you have implemented there will still remain, and TPME will still thrive. So your proximity, please use your proximity in terms of pushing agenda so that it can be implemented within other departments. Thanks.
Okay, thank you. And I think we had one more question in the far back there, and then we'll do a quick round of responses.
Thank you, panelists, for your diverse views. Mine is about the approaches. I would love to so much relate with the first presentation we had from Adeline. She said something about the approaches we use to collect this evidence. One of the examples she gave is that if I randomly asked someone how much they earn, it's so likely I will not get the correct figure. So to our representatives from the government, what are the efforts to make sure that we get the correct evidence using approaches that speak to our African people? And are there any structures to make sure that the people we collect evidence from buy in? Thank you.
I said quick, but then we got a very deep, profound question at the end. So do your best to be brief. It's an important question and a profound one. Mr. Clément first wanted to add a bit to the question on format, and then perhaps we could go to Harsha, and then anybody who's game can take up that last question.
Okay, thank you. Alors, sur la question de format, ça dépend de l'instance de prise de décision. En règle générale, la décision au plus haut niveau est prise par la conférence des chefs d'État et de gouvernement, qui est l'instance décisionnelle suprême de la commission. Et donc, à ce niveau, le format, ce sont vraiment des synthèses. Synthèses brèves qui sont faites à la conférence des chefs d'État et de gouvernement pour prise de décision. Mais nous sommes également intéressés par des études détaillées au niveau du Conseil des ministres et au niveau des experts statutaires. Mais l'instance la plus représentative pour la prise de décision, c'est vraiment la conférence des chefs d'État et de gouvernement. Et à ce niveau, ce sont des synthèses dont nous avons besoin. Donc voilà ce que je pourrais donner comme réponse à ce point. Merci.
Okay, thank you. Harsha.
Thank you so much. Gosh, I thought everybody will be nice and calm and peaceful and maybe sleepy after a very nice lunch, but these are difficult questions, but very nice questions. You know, the colleague with trust, it's such a big issue. So I would love to talk to you afterwards, because we've done a similar one with trust in the South African government. I think, Lubanga, for pushing institutionalization, there was a whole session that Marie and yesterday on institutionalization, right? And I want to say, if you think that we must enter a space to start institutionalizing, it's probably the wrong way around to look at it. If we see that policy processes are already underway, it's happening, there's the executive arm of the state, there's the legislative, there's the judiciary, there's an organized macro structure. And in that way, we have entered that space through the socioeconomic impact assessment system, where every government department, whoever is undertaking a policy review, has to go through a SACE process. Every cabinet member knows that. And when that comes into, I mean, it's already in place, right? So you're not going to have a tariff shift or a new policy direction or a review of a current policy approved if it doesn't go through a SACE. And what does that mean for us as the evidence community? It means that the first part of a SACE is to bring out the evidence by every government department. And not just evidence, as to what the options are. We're going to do this, we're going to do that or we're not going to do anything else. What's the evidence? So it's heavily evidence informed, and that's what the departments are actually struggling about, which is why we need to be the responsive that we were talking about, right? So it's there, it's in the making, it's catching on, it's a little bit like 3 years in the making in terms of being responsive from an evidence perspective. I think the part of the last question, you know, approaches to collect the evidence. Now, we spoke about scientific ways. Now, I think I will draw from what we do in South Africa, and one of the prime ways that we looked at, especially in high politics kind of areas, like land reform, there was public hearings happening where a little bit close to the way Truth and Reconciliation happened. Public hearings are where citizens come to discuss openly in a public domain their experience of these policy processes. There's recordings of it. And then government reports will be this compliance-driven exercise of regular reporting. So what we do in our department is to triangulate. And we triangulate what is, it's a very well-known rigorous methodology to be able to say, this source is saying that source is saying that, the media is saying this, who is right? But this opens up another can of worms, right? So these are very deep questions, and I'd love to talk more as well. Thanks.
Yeah, it's an excellent opportunity for a follow-up panel. Does anyone else, though, want to talk briefly about the can of worms challenge? Ismael, Deo, Laurent?
Yeah, I think that refers right to the question of how do we get gender and equity properly integrated in the whole process of evidence-informed decision-making. And so I chicken out a little bit by saying, I think you're asking the right question, but it's incomplete. So it's not just the research production where we need to bring these issues in. We need to do the same in the evidence translation process and the same in the evidence use process. So we're facing that issue not just in the production of evidence, but also in its translation and use. And if we only fix it in one part of the system, we still have it in the other two parts. And my colleague, Andile Banonsela, our gender and equity lead, she had a panel on this this afternoon. So maybe that's another chance for a conversation.
Okay, thank you all very much. I hope you all join me in thanking our colleagues here. We talked a lot about the challenge to do what they're doing, to accomplish what they're doing. But the fact remains they're doing it. I mean, in my mind, this is extraordinary. This is where the gears mesh when research and policy making come together, and that's how we get movement. So perhaps we could end the day with a round of applause for our colleagues here. Thank you.